Good evening, everyone, and welcome to GEL Health Advisors. And tonight we'll be doing Let's Talk Your Health, Your Wealth, and Your Legacy. And tonight I have with me Stacy, Yale, and Patricia Head. And we're going to be doing a mini 7-week session, which is designed to give you an overview of sources and techniques that available to identify benefits to assist you in reducing the cost of healthcare, create a legacy income for your family, your church, etc., and steps to being debt-free and tax-free. So tonight we're going to get started, and we're going to be doing health insurance. We're going to go over that and let you know where we stand with the health insurance. And as I get this set up, which will start in just a minute, let me get back over here and make sure we can get our screen set up for sharing. All right, so again, this is what we'll be talking about tonight. We're going to be talking about our topic tonight will be health insurance for ages 0 to 99. Health insurance for ages 0 to 99. So to get us started tonight, we're going to ask Patricia if she would just tell us a little bit about health insurance and why we need it.
So health insurance is very important. A lot of people don't go to the doctor because they don't have health insurance, and sometimes because they don't go, and sometimes by the time they do go, there are a lot of sicknesses that they have. They can be in like stage 4 cancer. They can have type 2 diabetes, things that cannot be corrected. That if they had health insurance, they could have gone ahead and gone to the doctor, received the proper diagnosis and the proper medication that they needed to prevent, even down to a cause of death can be prevented if we go to the doctor. I know people that go, if they get a little sneeze, they go to the doctor. And so I have come to find out that's very important, because you never know, a little sneeze can be a sign of a very serious health issue. So it's very important to have health insurance, to have that health insurance, to get your vision checked, to get your hearing checked. It was very important for me. I went to get my hearing checked. I'm below perfect hearing, but yet above being legally deaf. And because I'm doing something to prevent more hearing loss, then I won't lose that part of my muscles and it turn into dementia and Alzheimer's. So it's very important to have health insurance.
Okay. All right, thank you, Patricia, for that, because it really is important for us to have health insurance. And as we go through these sessions, I just want to tell you about some of the other things that we are going to be talking about. Let me move this out of the way. We will be talking about, next week, we'll be talking about creating a tax-free legacy income for you, your family, your nonprofits, etc. We'll be giving information on that. And then we'll be talking about why everybody needs life insurance with health benefits. That is very important, to have life insurance with health benefits. So if your life insurance does not have health benefits, you might want to stay tuned. And in this, again, in this mini series, we'll be talking about 6 strategies for retirement. There are things that we need to be doing before we get to retirement age. Actually, when you first start working, there are things, and even before you can start doing, but there are 6 strategies, and we'll be telling you about those. And we'll be talking about how you can have a complete health plan. Just because you have one type of plan, you might not have a complete health plan. So we'll be telling you how you can get a complete health plan. And we're going to bring in something real interesting called the $1 Million Baby Plan. There is a $1 Million Baby Plan. We'll be telling you more about that. And And the last thing we're going to talk about in this mini series is what you do if you don't have a long-term care plan. Just what can you do? So stay tuned in the coming months and we'll be talking about that. But right now we're going to go back to health insurance and we're going to ask Stacy to come and tell us about Medicare.
Okay, well, Medicare is for someone who is 65 years of age, or they have been on disability for the last 24 months and they are younger than 65. You have to have worked 10 years to be eligible for Part A and Part B. And um, the open enrollment was from January 1st until March 31st. Right now, we are in a special enrollment period, or SEP, and that is running until July 31st, 2021. And this is due to weather, the pandemic, and other issues that are going on right now. So first of all, to qualify for a Medicare plan, you have to have Part A. And Part A is for inpatient hospital care, long-term facility care, home health care, hospice care. Part B is for doctor's visits, specialist visits. It's also for home health care, durable medical equipment like wheelchairs, walkers, hospital beds, and other equipment. And there's also preventative services like vaccinations, yearly wellness, other types of screenings. So when you turn 65 or when you're eligible, if you're under 65, you Part A and B are part of your plan, but you have to choose a Medicare Advantage plan, which would include Part D. So Part A and Part B together equals Part C, which is a Medicare Advantage plan. And if you do not get into a plan, you are penalized. And if you have any questions regarding your Medicare Advantage plan, or if it's time for you to start a plan, you can give me a call at 770-713-7402.
Okay, thank you, Stacy. And I'm going to give you some more information on if you are under the age of 65 and you're not on Medicare due to disability or some other reason, end-stage renal disease or anything like that, you qualify for health insurance. And right now we are in a special enrollment with our health insurance. We're in a special enrollment with our health insurance. As we continue to battle this corona disease, of 2019, we have what's called a public health emergency, and it's more important than ever that people have access to affordable health insurance. And because of the America Rescue Plan Act of 2021, which President Biden passed, it expanded the health coverage and it lowered the cost on plans brought through the health insurance marketplace. So under this new law, more people than ever before qualify for a tax credit, and it has a lower cost to the health coverage, even if they weren't eligible for it in the past. People that income was too high that before that they could get it, but they didn't have any tax credit, they might find now that they have tax credit. And most people currently enrolled in the marketplace will qualify for even more tax credit. And the health insurance premium after these savings will go down. There are even some areas where the premiums are even zero. Now, the consumers can take advantage of these savings and lower costs through 2021 through this special enrollment period, which means that we can get you qualified and enrolled in a plan up all the way through August the 15th of 2021. And for instance, if you enroll now, your plan will come effective the 1st of June. Or if you enroll after June, then July. So it's always the following month. So who's eligible for this special? We encourage everyone to at least call and see if you qualify. You can either go to our website, which is GEL Health Advisors with an S.com, or you can call our number. Our main number is the number you're seeing there, 678-956-1181. But our message center right here, our message center is 817-381-1500. So I would encourage you to either go to the website or call that number and let us see if we can get you qualified. And like I said, a lot of people can get coverage and don't think that they can get coverage. Now, if you're covered by your job or you're covered by the military, you're on Medicare or Medicaid, this is not for you. But anybody else, this plan is exactly for you. For example, a family of 4 could get covered in a whole plan for about $160 a month. And that's real good. So we encourage everybody to take advantage of this. And even if some people might not know about it, if you hear about it, spread the word, because we want everybody to have coverage, because this pandemic that we're going through now, we don't know what the outcome of this is going to be. So everybody, at all times, everybody need health insurance. Everybody need life insurance, but surely during a time like this, and when everything is so lax, then you can go in and get this. Oh, another thing too, if you are on unemployment, if you got at least one unemployment check this year in 2021 in July, your health premium will be $0. So let people know that's on unemployment. Hey, you can get health insurance. You can get health insurance for you. You get health insurance for your family. And that's what this is all about. So we're just here tonight to just let people know that all of this is open. We have a special election period that you may qualify for Medicare. We have a special enrollment period for health insurance. And then if there are some other things that you would like for us to talk about, just give us a call. Let's have a conversation, because just like the president and others are trying to get everybody to get the COVID shot, we're trying to get everybody to wake up and say, hey, you have access to health insurance. You can have a health insurance card. You can actually get coverage. So that's what we're doing. We're trying to get the word out, but we need your help to help us do that. So give us a call at 817-381-1500. Or you can call Stacy. And Stacy, what's your number again?
770-713-7402.
Or you can call Patricia. And Patricia, your number is
404-821-8556.
Okay. So we're not going to keep you here too long tonight. Ladies, do you have anything else you want to add? Stacy?
No, I can't think of anything right now.
Patricia?
Just want to encourage everybody, hey, call in. Let us help you.
Okay. All right. Good night. And we will see you again next Monday night. Hopefully Facebook and Zoom will get it together, or maybe it's me that need to get it together and we can come on live. It'll be next Monday night at 7 o'clock, and we should not keep you any longer than 7:30. Have a good night.
Good night.
Good night.